exciting set of people here with me on the stage. And what we are going to do today is to reflect on what has happened in the last 2 days and also reflect on COPASA and what COPASA has set out to do from our own vantage points. And we're going to follow the same practice as the other 2 plenaries have done. We will have 5 minutes of opening from each of our friends here. And after that, there will be questions and answers based on what they have said. And we are also asking our friends to speak to each other, to the points that others are making, and take those forward or question some of those. We will also be waiting for questions from all of you, and you can write your questions and give them to us. I think that's better than waiting for the WhatsApp number. I'm encouraging friends who need not or cannot write in English to write in their own language. We have Ariel here with us. I'm here to read out Hindi questions. And if there are any other language questions, I'm sure we can have friends who are here to, address and translate those for us. I'm also going to ask you that if you feel more comfortable in grabbing a mic and asking a question, please do that. But do make sure that your question is succinct, your comment is succinct, and not too lengthy. So I guess that's it. I think we will now move with our speakers, and I'm asking Ravi to introduce our speakers one by one and invite them to say what they are going to say.
Thank you very much, Renu. Just one follow-on point about the questions. We'd like to give each speaker the 5 minutes to present their case, and then we'll open up for the questions. So as you're listening, make notes of the questions, because we want to get all the ideas on the table so that we can then interrogate each one. I know it means that there's an extended period, but all the speakers have agreed to be very, very brief, so we'll rely on them for that. I'd like to first introduce Boyan Pavlovsky.
But also difficult to be the first presenter on the last day of the symposium. Already so much was said, so many brilliant ideas and so many realities were presented during 2 days. I come, as Ravi said, from Southeastern Europe, and Europe for many people around the world seems like a promised land. Yet in Europe we face many difficulties, especially for the marginalized group. I will speak more about the Roma ethnic minority, or because we have international audience, they are also referred as gypsies or gitanos or Tziganos. Some of them words can be offended for them, but I just want to have understanding what Roma means. They are ethnic minority in all of the European countries without their own country. They face extreme levels of marginalization and exclusion in society. Their neighborhoods look like slums in any of the Asian or African countries. They face poor education, unemployment, poverty, all exclusion in all the aspects, including access to health and healthcare. They have poor health outcomes, and they live life expectancy 10 years shorter than the European population in general. Although since 2005, European countries committed to improve the situation of Roma when the decade for Roma inclusion was adopted, and afterward followed by the EU strategy for Roma 2020 and so on. Unfortunately, although these policies were very well developed and in inclusive process by the Roma civil society representatives, unfortunately we have seen a lack of implementation and under-implementation of all of these policies. This is due to many reasons. First of all, because there was really low level of accountability, and Roma community and civil society organizations were not involved in the process of monitoring and evaluation of these policies. And there was a very low level of political will and commitment of the governments to implement all of these policies, which could be reflected with a real low budget, earmarked budget for this implementation of the policies, and even lower spending. It's very difficult to work to advocate for improvement of the situation of such a marginalized community when it is accepted by the majority of the population that their status is like that they are marginalized, they are excluded. So there is no political points for the governments to do anything. So all our advocacy seems vain in this regard. That's why we are continuously working on empowerment of the Roma people to raise their voices and to demand fulfillment of their rights. Of course, as I said, they face marginalization, discrimination in all the aspects. That is why what I hear here on the symposium is similar to all the marginalized groups. That is why I think we should further on not be bounded just on the access to health and the health right, but we should think in a more broader sense and work more towards addressing the social determinants of health or other aspects of their life, including education, employment, access to other services, social services, and so on and so forth. Because maybe that will not give an impact on a short run, but definitely we must have a vision forward to take them out of their marginalization and exclusion, because they have been in such a position for decades and even centuries in Europe. So we must do some substantial work to take them out of their levels of marginalization and exclusion. And what I wanted to emphasize that here in this symposium and through my experience with COPASA, and many of you can hear that the situation is the same with the Roma in Europe, with the Dalits in India, with the indigenous people in South America, with other vulnerable groups, with LGBT population and so on. I wanted to just to stress that we really, but this is what we are talking among us. We really should bring this issue on the international level to be recognized that all of these people coming from different kinds of worlds face the same levels of exclusion and same problems in accessing the right to health and other human rights. Thank you.
Good morning with everybody. The issue that we wanted to cover was how some key themes that have been mentioned along these days resonate for Latin America. And first of all, I will mention inequalities. Latin America is the most unequal region in the world, and differences of access, opportunities, resources, and power are cruel and stark for many people. The discrimination that is embedded in part of this marginalization is also high, and I think I could mention this for almost all Latin American countries. And inequalities are hidden by national averages and some stories of success, no? Like, for example, in Peru, that you will find many World Bank documents that talk about the success of Peru in reducing chronic malnutrition. However, almost 1 of each 2 children under 5 have anemia. I can understand why, if we are successful in something that is related to nutrition, we have still to go farther for reducing anemia. But there are more stark cases in terms of newborns, in terms of delivery for rural areas, etc., along all Latin America. So inequalities is one thing that should be highly addressed, highlighted by our efforts. And we, in the Latin America regional meeting yesterday, we were talking about how we could extend our participation at COPASA, how we could map other important efforts and include them and create alliances so we could address some of these issues. A second issue that is almost crossing all Latin America is the promotion of universal health coverage as the objective to be reached. However, there are problems in the conceptualization of universal health coverage. For many Latin American countries, Governments have understood universal health coverage as universal health insurance. And at the end of the day, for the poorest people and marginalized people, they have also been changed from a paper where it said they didn't have insurance to a paper or a registry where it says they have. So universal health coverage, and at the end of the day, for many people, the most needed people, has become universal health registry. They even don't know they have access to free health care whenever they reach the facilities, and that's another problem. The old problems of physical access, cultural, economic access, etc., have not necessarily been addressed. So it's like if I say to you, you have free health care at Miami, but your problem is going to Miami. No? So that's a big issue in Latin America. Universal health coverage approach, as the governments understood, is more related to facility-centered approaches, financial, especially financial-centered approaches, but not people-centered approaches. And you could see that mostly in all the papers that cover universal health coverage. They talk about the problem of financing, but they never have in the famous cube the dimension of quality, the dimension of cultural respect, the dimension of dignity within health facilities. And we know these are problems. A third issue is citizen participation. Citizen participation, and I would like to talk later more about the conditions that are needed for citizen participation. And a fourth one is accountability mechanisms, governance and accountability mechanisms that are weak in our countries. Even though there are norms, even though there are some initiatives that are important on credit to the governments, but they are not implemented because there's not a culture of accountability and there's not the political will to propel this. Moreover, there has been some retaliation to human rights advocates whenever they have raised issues that have been not comfortable to the government, and I would also like to talk later about this, no? Because in Peru we had some problems about this, in Guatemala we had problems about this, etc. Finally, I have to mention that in general in Latin America we have lived a wave of massive corruption, at least in South America. Probably most of you have heard about Odebrecht scandal. Is a constructor enterprise that has been bribing almost everybody in the governments to make their activities and their actions. And this has like taken a mask to all the people in Latin America on the challenges that you face whenever you are within the system, no? The challenges that you also face when you are member of a progressive government, like we have had before in Latin America, and you cannot reach all what you wanted to reach when you were outside claiming for rights. And this is a complex reality that has to deal exactly with not only norms and laws, but also on actors dynamics, and I think we need to explore more this, and COPASA has a role on highlighting issues that nobody's talking about in Latin America. We have that role, and we are going to accomplish it.
I'm going to give emerging concerns from Africa. I'm from Uganda, but we do work in Africa, and we have also had some discussions as Africa group. What's clearly coming out is the commodification and marketization of health. Health is in the marketplace. And we also saw the rising dominance of the private sector and the private sector of the transnational corporations in the health sector. Another emerging issue is the continuing withdrawal and weakening of governments to provide these services, to provide health services, but also the capacity of our governments to regulate the private sector in our interest. Another issue which is coming out is the role of the donors and the financiers, like the World Bank. They are setting priorities of what we should do. And we see a move from preventive to curative, most of the money going to curative, building infrastructure and buying equipment. So the people, the citizens, are caught in between there. They are squeezed in between, I won't say greed of the private sector, maybe the search for profit. So they are squeezed in between
the private sector, between the inefficient government and the wishes of the donor. And for us in Africa, what we saw is that the citizens' capacity to defend their rights, to demand, is a bit limited, especially for us in Africa. We saw in Asia, mobilization of communities is a bit at a higher level. So how do we move forward? We need to work vertically at different levels, community level, there are challenges there, national level, regional and global level. But the levels should be mutually supportive. What we see is sometimes the community level doesn't know what's happening at the global level. Maybe we'll talk about that later, how we can be able to do that. Then we also need to work horizontally, at horizontal level. My brother here has talked about social determinants. We need to get out of the health sector to defend the health sector. You know, we have been talking about the neoliberal policies, talking about the private sector. The private sector is regulated under trade and investment rules, so we need to go there. So we need to work with different sectors, trade, investment, the food system, the food system, the GMOs, the use of chemicals. Glyphosate is an issue causing cancer. We need to work with the debt issue, the aid, budget, to ensure that there are budgets, issues of climate change, So we need to work across, and maybe we can be able to talk about how we can be able to do that. There are very, very important processes going on. Today in Geneva, there is a campaign to put in place a UN binding treaty on business and human rights. And this will help us to make sure that the corporations are accountable, but also to legally protect the rights of the citizens. So for me, I think there are room to work together as COPASA, because we have the same challenges and we have the same common enemy. Maybe I can stop here. Okay, thanks.
Focus on as COPASA moves forward over the next 5-10 years. I have to say this has been an incredible conference and a steep learning curve for me. And I have learned a lot on the landscape of accountability and realized that it's a very complex process and a complex web of relationships at every level of the system and very context specific. So 2 key points I just want to raise, taking over from Jane. I think one of the key areas, and there have been huge discussions over the 2-3 days in terms of this global versus the local disconnect and how agendas are being enforced by from the global level, how national agendas are shaped, and what are the implications for accountability on that level. So in my mind, it's not such a black and white divide. And I think we need to do a lot more work in terms of what are the alliances that are being forged at every level of the system that shape certain agendas. And COPASA, while it's done quite a lot of work at the community level, does need to now engage more in terms of what's happening at the national and the global level. What alliances are being forged? How are budgets determined? How are budgets divided that shape the organization of delivery of services across the country? That will give us a lot more in terms of what are the key actors involved and the advocacy that needs to follow up from there. So that's one point. Linked to that comes the whole sort of question of private sector and private providers. And who is and what is the private sector and who are the private providers? Different in different countries. I think from India we've seen an extreme case. Jane, where we come from, yes, the private sector, it's a very dangerous player. It is a dangerous player. But we, as we move towards UHC, and no matter what shape UHC takes in different countries, to sustain the limited gains made and the incremental gains made across the way, the role of the private sector is going to be incredibly important. How do we forge that partnership? That's a win-win. And that's going to be quite a complex situation, because I realize in every health sector review meeting, comes this priority, regulation of the private sector, but it never gets addressed. And we need to understand why it's not getting addressed. Now, who is the private sector? And that's also a big word we need to unpack. It does come to the question of that we need to look at it from a social determinants of health agenda and the SDG agenda with a focus on not only health, but well-being. So what does that mean in terms of advocating other sectors to support the health sector and lessen the dependency on external financing? I think that's important. In terms of private providers, again, we need to unpack that. Who are the private providers? Where I come from in Tanzania, there's no clear demarcation between public and private providers. The public become the private at night, and the private become the public. There's a growing concentration of the unpaid private or public providers. As the demography of the health changes, more and more care goes beyond the facility down to the household level. This is the silent majority of the women in the households who are taking care and bear carrying the unpaid burden, which has huge implications in terms of accountability. So when you look at all this relationship and sitting in a donor meeting, they will go, we are accountable to our taxpayers. You sit with the government, they'll go, we are accountable to our finances. You sit with the providers, they'll go, we're accountable to those vertical financiers. So how do we enforce accountability to our citizens? How do we force that level of independence? And I'll stop there.
I should start by saying this has been an incredible 3 days, lots of learning, and I'm really taken up by the energy of all the participants. So thank you everybody for making this very worthwhile. I'm going to speak really from my perspective, sitting in a research institute doing research, and what are the priorities here. And not surprisingly, what you might expect, I'm going to say that we need more research. That's what researchers say. But I'm going to say that we need research that's oriented in a particular way, not just research for itself. So the first thing to say is that what's happening in the social accountability field is that practice, as you can see from the different experiences that were shared here, is racing ahead of the research and knowledge production, and in the last decade or so. And what knowledge is being produced, as was mentioned in yesterday's plenary as well, has been oriented a certain way. It's very projectized, top-down, donor-focused, intervention-oriented, asking the question, what works, from a very top-down fashion. And we need to take back the focus into what works for action strategists, people who are working with these issues on the ground. What does all this experience really mean for knowledge production from the bottom up? So there's this need for rebalancing. We need to document it. A lot of this experience hasn't got documented. We need to analyze it for learnings for